My name's Booth Armstrong. I work for OHD. I want to welcome everyone to this panel discussion hosted by OHD on safely re-implementing or implementing your respiratory protection program in this current season. We're going to get started in just one moment. Want to give some people the opportunity to log in and get settled in. So just hang tight and we'll get kicked off in just one moment. Glad to have you here. If you're just logging in and joining us, we are giving everybody an opportunity to get logged in, settled in, and we'll be kicking off in just one moment. My name's Booth Armstrong. I work for OHD, and we're excited about this panel discussion on safely re-implementing your respiratory protection program. We'll get kicked off in just a moment, letting everybody get settled in and ready to go. All right, I think we've given some time for people to get logged in and settled in. My name's Booth Armstrong. I work for OHD, and OHD is excited about hosting this panel discussion on safely re-implementing or implementing your respiratory protection program during this unique season we're in. Our hope is that this will be a dynamic resource for you, and it will help you manage your respiratory protection program in this unique season. Many of you are familiar with OHD, and we're excited about continuing to connect and engage with you. For those who are having their first experience with OHD, I can give you a quick intro to who OHD is. OHD exclusively represents two patented technologies globally. The first technology we represent is called the Quantified. The Quantified does a very fast, very easy, very accurate quantitative respiratory mask fit test that's recognized by global bodies globally. So regulatory bodies globally, excuse me. So that's the Quantified. It's our legacy product. It does a fit test on average in 2 minutes. It doesn't require any consumables. It doesn't require you to probe a respirator. It doesn't require any environment for you to test in. And it uses a patented controlled negative pressure technology to challenge the fit and integrity of a respirator with air and it just produces a very accurate, fast, and easy fit test. So we're excited about this, and it's our legacy product. Over there in the box is a new innovation, which is called the QuantiCheck. The QuantiCheck performs the world's first quantitative user seal check or fit check. It's a very, very neat innovation. This device will remove the subjectivity and challenges of the fit check or user seal check with placing your hand over the air inlet and breathing in properly and experiencing or determining the fit and integrity by sensing pressure decay. It removes all of that. It's simple, it's accurate, and most importantly, it brings quantitative results and confidence to your fit checks and user seal checks. So that's a little bit about OHD and who we are. With that covered, let's jump into and meet our panel that we've got today. Excited about introducing you to our panel. So if you logged on early, you got the opportunity to review this outstanding panel's bios, but I'll introduce you to them rather quickly now. First, we'll introduce Mr. Varner. Do you want to give a wave of the hand, Mr. Varner? We're super excited about having Mr. Varner. Mr. Varner has 39 years of experience concerning respiratory protection for first responders. And Mr. Varner has even authored a 3-day respiratory protection course that's been implemented nationally and had thousands of first responders successfully complete that course that he authored. So very, very excited to have you join us today, Mr. Varner, and appreciate what all you've done for our first responders.
Thank you, Booth.
Absolutely. Next, we have Dr. Kusti, a little away from Dr. Kusti. Dr. Kusti is a dear friend. He's got over 10 years of occupational medicine, public health, population health, and corporate health experience. He's got a vast background or experience as a chief medical officer and is now the founder of Optimal Workplace and Environmental Wellness. And very excited to have you join us, Dr. Kusti.
Thank you for having me, Booth. I'm glad to be here.
Absolutely. And then excited to have one of our own, one of OHD's own, join us. This is Dr. Lynch. Dr. Lynch, you want to give him a little wave? And Dr. Lynch is undoubtedly going to provide a lot of great perspective. She has a PhD and a background in industrial hygiene and safety across multiple industries. She's a skilled researcher with a broad knowledge of respiratory protection and fit testing, and we're excited about having you, Dr. Lynch.
Thanks for having me.
Absolutely. All right, so we've got our panel, we've got our topic, and let's jump right into this so we can really get going on how you can safely re-implement your respiratory protection program in this unique season. I want to start our panel off with a real basic, but I think a great question. And that question is, can we restart our respiratory protection programs? And I'd love for Mr. Varner to lead us on that question, and then we'll open it up to our panel to provide any additional thoughts. So, Mr. Varner, what are your thoughts on restarting a respiratory protection program?
Yes, starting your program back up with everything going on, it can be done. A lot of people are starting to do that. When we look at the challenges of a respiratory protection program, we look at 1910-134 and the OSHA standards. And in C1, there's 9 steps to a respiratory protection program already. And one of the last steps there is to evaluate your program. So you can go back and look, if you've done that and developed a program, you can look at it and see what you've said you've done and not done, where you left off, maybe before the COVID-19 happened, to fire back up. But you can evaluate your program like we normally would on an annual basis. This would just be now taking a look to see where we're at, where we left off at, what still needed to be done. But with that saying, and recognizing what you may have not done, there's some things that's happened during the virus that has drawn our attention to fit testing, such as when we look at the OSHA memorandums that came out. There was one that came out initially on March 14th that pertained to healthcare workers initially, and then on April 8th it got expanded to all workplaces. And basically that memorandum basically gave the guidance for the compliance officers that are out there when they go out, that you still needed to do initial fit testing, but the annual fit testing was waived. But that didn't exclude you from doing other things. So you just couldn't say, well, I don't need to do fit testing, we can move on. You still need to do initial fit testing, but if you were doing refresher and you were trying to do your annual and all that and trying to get that in with everything going on, they were trying to give some leniency to that. But it didn't leave you out from doing other things. People still needed to know how to put a respirator on, how to wear it, how to don and doff it, how medical screening, training, all the ins and outs, maintenance, all those things still needed to be done. It was just trying to keep you from having additional workload of doing annual fit testing. So everything else was still included. That was just one of the things. So healthcare initially, all workforces now have that. But I've also understand that as things become more available, when things become more on the market because of the shortages, that doesn't, you still need to go ahead and do your annual fit testing when you can. This was just giving you leniency till further notice. If you can accomplish it, great, was what was out there. There's some additional information out there as well besides OSHA. CDC's come out with some information as well. You can go to cdc.gov and look it up in CDC, and they give out monthly bulletins. One of the informations they had on a subject was the strategies for respirator shortages in non-healthcare sector, because people were having a hard time getting their respirators. So when they're trying to fire up their program, do you have the equipment or not? If you don't, if you have shortages, how can I adapt to that? What else can I do? What are some other options? So CDC actually provided guidance on that, ways that you can look at for that. We've also, when we think about respirators, through cdc.gov, we should look up the National Personal Protective Technology Laboratory, NPPTL. They are the ones that actually certify our respirators. You can look by make and model. You can look at what you have to see is your respirator proper. Because surprisingly enough, there is another subject CDC had out there to complement that, and that was counterfeit respirators and misrepresentation of non-approved respirators. So those are two subjects you can look up on CDC's site to give you guidance on selection for non-healthcare, if that's who we're talking about, and then also misrepresentation, or in this case here, maybe a counterfeit respirator. So there's things that we need to look at, what our equipment is we're going to be using, and where are we standing right now.
That's lots of great info. Love that. Dr. Lynch, Dr. Kuste, we'll let Dr. Kuste take first crack at it. Do you have anything you'd like to add to a lot of the stuff that Mr. Varner shared?
Just very briefly, want to reemphasize that point about the expanded of the temporary guidance in April that came and extended the March memorandum, is that it was, as Mr. Vernon mentioned, that it was due to supplies issues. However, initial fit testing and annual respiratory training, as well as the respiratory clearance exam, are still required and should continue. It is worth mentioning, and I can touch on this a little bit more later, that the medical parts, such as the medical questionnaire and the physical assessment by a licensed healthcare provider, can be done utilizing technology such as telemedicine technology. But the continuing of the program to assure the safety of the workplace is very important, and it is my belief, and we all know that it is the employer's obligation to ensure that the workers are safe at the workplace, and that's obviously according to the OSH Act in 1970, also known as the OSHA General Duty Clause, and that the employer really needs to show that they are taking all measures and in good faith and doing everything in their power to protect their employees in the workplace. And if the employer has the ability to perform annual testing or restart the program as soon as possible, then they should do so. Thank you.
Absolutely. Dr. Lynch?
Yeah, I mean, I think that's actually goes to the heart of everything, right? We still have an obligation to comply in good faith with the standard. So when we talk about re-implementation, that's only of the features that maybe we had to stop due to shortages or people not being around. So those are things like being alleviated from that annual fit testing. So right now, yeah, that's just what we're doing. We've got the obligation to still comply where we can, and they're just providing some leniency for those things that became difficult to do in these crazy times that we're living in, right?
I think that's great info, and I love the fact that we've still got a lot to do to provide protection for our workers. And I love the fact that there's a lot of great resources that Mr. Varner was able to point to for people to really continue to educate themselves on what that looks like. All right, so I think we may have covered this pretty well, but just to ask this specific question to make sure that we don't leave anything on the table, what are the current guidances that everybody should be aware of? Mr. Varner did a wonderful job of highlighting a couple of those like I just mentioned. Are there any other current guidances that we need to be aware of when managing our respiratory protection program? Mr. Varner, do you want to take a first crack at that and share if there's any additional information on that?
Just a couple things as we lead down the path here. Planning, looking at planning on how we're going to do this, and this is going to lead into other topics, but planning on how we're going to do this. Normally we would have people come in maybe on a certain day and have them come in, so many per hour. We give them information now about, facial hair, smoking, drinking, having your face clean. We do a lot of that now, but there's other issues that's going to arise now because of the COVID issue. So we'll talk about that as we go for medical, but planning is going to be a big part of it. Having enough people to help you, protecting the person. We're used to, as people doing fit testing, we're normally not protected because they're wearing a mask, the air's fine. Well, now we got to be concerned with the tester, the person actually doing the testing. As the person's there being fit tested, who's the one fitting them? Are they protected? And the room and all of that. So planning is going to be key to this as we proceed, as we start doing our fit testing. And that can be equipment and cleaning items that we're going to need to maybe wipe things down, clean things off, switch things out, have spares to switch out while somebody's cleaning it. It may take more staff, a little more timing. Instead of doing so many so quick, we may be doing a little slower, but we want to be successful with it. So once we get a plan, we want to make sure we don't fail in the idea of people coming into fit test and it's taken too long, people are backed up. So we just need to plan better.
I love that. And I think that I love you sharing that. I think we're even going to dig even deeper into some of the exact plans here in a little bit. So that's fantastic. Any other guidances outside of the OSHA and CDC stuff, Dr. Lynch or Dr. Kusti, that you're aware of, or do you think that we've got everybody what they need to know on current guidances that are out?
Well, kind of stepping a little bit outside of maybe the regulation, I know that, so for me, my background is in industrial hygiene, and AIHA has released a lot of stuff, and it's not, as respiratory protection focused, right? But they have a lot of stuff for cleaning your workplace and a lot of guidance documents that they've developed that could be really useful as maybe you're moving to having more people be on site, or having people come in for something like we're talking about, like for fit testing, or I want to touch on something that Mr. Varner said. There's this fine balance that we have to walk, which is planning and making sure we have enough people, right? But making sure we don't have too many people too, because we want to allow for that social distancing. We've all been told how important that is. And then also don't do any unnecessary fit tests or have any unnecessary people who are going to end up just being, people are our exposure, right? Other people are that exposure. So you don't want to have any excess of that.
Love that. Love that.
Mm-hmm.
Dr. Kusti, anything to add there?
Yeah, I think it's also important for us to realize, like the main concern, obviously, as mentioned by the panel, is we don't want to spread the disease, and we don't want to have people get infected by the disease. So one of the very important things is that, if the employee or the worker that's being fit tested before they even sit and get the fit test, if they appear to be sick by manifesting or reporting any kind of flu-like illness, then it is recommended that that employee should not be tested and must be removed from, if it's in the workplace or the clinic, and referred to a healthcare provider for an evaluation. The employer may perform, respiratory clearance for these employees, but they can do it only if whether it's the fit test or respiratory clearance, only if the worker is not ill or has not been screened as high risk for having COVID-19 or spreading COVID-19, and or even if the worker has already contracted the disease, if they have properly cleared the illness, and that should provide a lot of layers of protection. There's also guidance from the ACOM, the American College of Occupational and Environmental Medicine, to suspend some of the activities on the medical side, such as spirometry, for the time being. However, it is worth noting that spirometry is not a requirement. It is a tool, one of the tools that's used, but it's not a requirement to clear somebody to get fit tested. A lot of the employers that I'm working with, they have implemented a COVID-19 specific health questionnaire or health or risk assessment questionnaire prior to then even being allowed to be on property. And if that is in place, then that should be definitely utilized and looked at, paying attention to it, which is a little bit different than, as Mr. Vernon said, than our usual practices.
Well, and I love your point. This is kind of combining the past two things you've talked about, but that there are certain aspects of this that we can accomplish via telemedicine, so that, if you are limiting personnel on site, you still have things that you can accomplish that are moving you towards your goal of making sure that your respiratory protection program is still up and running and still accomplishing goals. That's something that you can actually work through with our planning stage, right? So it's getting a team together, having something like our panel right now that's got bringing different people with different backgrounds to talk about how are we going to move forward with the respiratory protection program. Let's evaluate the program as a whole. Let's take this time to do that while we're not in the office. And then we're going to initiate those medical screenings for those who haven't had one yet. We're going to have them come in staggered groups. This is all just really, I think that's very valuable, what you pointed out. There are things we can keep accomplishing even when we can't be on site.
Very, very.
Booth, there's a couple things too that's also came about with this, is the idea of what everyone was used to doing has changed, in the fact maybe we're going to wear a different mask than what we wore before. We ran out of those. Now we're going to wear this, which requires fit testing on the initial size. So you may have had annual fit testing you were planning, and now it's like, oh, we've got multiple masks. We may have went to a different brand and make and model. So those still throw us into the fit testing requirement. So that's a challenge for us, moving people out of the room. And, and there's advantages for ventilation too. We're used to being sometimes in tight quarters to perform this. The advantage of the Quantified, you can use that in an open air environment. You don't have to be restricted to a little room where you're worrying about particle count. This here is a different concept, so that's a benefit. But there's just things we've got to look at big picture wise, what needs to be done cleaning wise, replacement wise, which is going to be a planning stage. So
that's really
and part of that planning stage, and as Mr. Vernon and Dr. Lynch mentioned, is that looking at the current CDC guidelines and following them while performing these tests. So practicing physical distancing between the tester and the worker can still be accomplished, whether the tester can set up everything and then leave the room, or however, if there's enough distance that they can step away and maintain that 6 feet distance. Also, the tester should follow CDC guidelines for practices such as hand washing and other cleaning practices, as well as themselves utilizing universal precautions and proper PPE, such as face cover, gloves, gowns, etc.
Love it. We're covering all kinds of good information here. The next question that we have, and we've already ventured into this, which I love the organic discussion moving there, is what do you see as likely issues / concerns? And are there any times when you're not going to fit test someone? And we've covered a lot of that already, which I think is fantastic that the discussion's already carrying us to the next natural topics. But just to go ahead and put that on the table to make sure that we address that directly, we'll let Mr. Kusti take first, Dr. Kusti take first crack at it. Is there anything that we haven't covered, or even something you may want to just quickly reiterate on as issues or concerns when restarting your respiratory protection program, or when not to fit test someone, or to remove them from the respiratory protection program temporarily?
Right. So one of the basic things that needs to be done even prior to the person being fit tested is getting a medical clearance. And an employee should, and this is actually written in the standard, the 29 CFR 1910.134, that there's two components, required components, that needs to be done prior to the employee being fit tested or giving a respirator, which is a health questionnaire and a physical evaluation by a licensed healthcare provider. That alone should capture and remove a lot of the uncertainties of if a person is potentially contagious or ill. Obviously, if they have any underlying clinical condition that would prohibit them from tolerating a respirator, then they should not be fit tested. Also, just to reiterate what I mentioned earlier, that if an individual appears to be sick or have any kind of flu-like illness, or reports that they were in close contact with somebody who were confirmed diagnosed with COVID-19, then that individual should not be tested at that point until they get further evaluation and clearance.
Very good. Mr. Varner, Dr. Lynch, we'll let Dr. Lynch go first. What do you have to add to that, if any?
One thing that I'd like to add about, thinking about concerns as we restart some fit testing is the big picture of, because of how fit testing is performed with the filters not in place, and because of the training that's an aspect to the training aspects of fit testing, the person being fit tested is not being protected. If we're making that assumption that everyone could be infected, which is really how we have to operate, right? And then if you think about then that fit test operator, I think Mr. Varner touched on this, them being in personal protective equipment, that may include, a form of respiratory protection, because they're not, because of the way a respirator works, especially when we're talking about elastomerics, or the filtering face piece with the exhaust valve, that their air is just coming straight out into the environment. So the fit tester is not being protected because of how fit testing is basically performed, or because of how the respirator works, and then the person being fit tested is not being protected because of how fit testing is performed. So those are just some sort of big picture concepts that seem to keep coming up with our customers, where there's, they're wondering about where the risk is, and the risk is, again, these other people. So that's just an important note. So your best practice may be to have your fit test operator in their personal protective equipment, including some form of respiratory protection. And we'll get into some more best practices, I'm sure. But so it's just important to note that with fit testing, neither person involved is being given some form of protection.
Absolutely. Mr. Vaughn?
Just keep in mind, too, people are going to be coming in maybe wearing a face covering already, and the misconception of face coverings and respirators, I'm wearing a face covering already. Well, that's not a respirator. And then we get in the issue of people wearing an N95 because that's all they've got to wear, but that is a respirator that does require fit testing. So, people get confused on the face coverings. You may have people wearing them in and then putting on a respirator. People understanding because the news has stated things, but we need to make sure that they understand, whoever the clients are, that these are things that you need to be aware of, that what is a respirator, what's a face covering, what is sufficient, what's not. and the confusion there, because people are running out of equipment and using different types of equipment, and then pretty soon a face covering's everything. Well, until you step into what a respirator is, and then that changes the world, because then that requires fit testing.
Yeah.
Mr. Varner, I have a question that I feel like you'd be better suited to answer. Like, as we move forward in this environment, I feel like a lot more employees are going to be venturing into this idea of voluntary wearing of respiratory protection. Can you speak to that at all, for what that means for your program?
Sure, because what happens is when an employee comes to an employer and says, hey, I'd like to wear a respirator, if there's no hazard that the employer has identified, a respirator is not required. But if the hazard is present, the employer has to provide you a respirator per 1910-134. So when we look at that and you say, I still want to wear a respirator, B2, which is an appendice of 134 standard, basically says, if I let you bring a respirator in and wear it voluntarily, such as an N95, and it's not a hazard, I, the employer, have identified that that hazard does not exist, then if I allow you to wear it, then I still have to do training. I have to show you how to put it on, take it off, how to don it, doff it, clean it, store it, maintain it, dispose of it. They still need a medical questionnaire performed, even though they're voluntarily wearing it, because when they do that, could they still have a medical occur while they're wearing it in your workplace? Yes. So you get into liability and who allowed what. So, and you have to give them a copy of B2 appendice that basically states, if you're going to wear this as a voluntary use respirator, these are the requirements. And so that they understand they have some responsibility too as the worker. It can't all be the employer. Once you voluntarily bring it in, yes, once I allow it, it opens a door to things that I need to do as an employer. But you as the employee still have some responsibility because you're wearing it and what you're supposed to do with it. So yes, there is.
And I would add that to that point, just to confirm what Mr. Vernon said, all respirator wearing personnel must have a medical evaluation by a licensed healthcare provider. This is to determine the employee's or the worker's ability to use the respirator safely without any health adverse effects. And this is part of the OSHA standard 29 CFR 1910.134, especially section E of that standard. And this is, the OSHA explains it, and even in the medical society, we understand this, that because using a respirator may place a physiological burden on the employee that would potentially vary by the type of respirator use, but the medical evaluation must occur before the employee is provided a respirator or wearing it, and even before doing a fit test.
That's just definitely an issue I kind of see moving forward, is either employees requesting that option to wear actual respiratory protection, viewing COVID as the risk for themselves. And then I also wonder if we won't wander about certain workplaces and those facilities where maybe you have a great number of employees, and you might identify that use, and they're maybe unwittingly or unknowingly wearing the N95 that is a respirator. And so now we have that obligation to go to them and clarify everything that Mr. Varner and Dr. Kusi just said. Let them, inform them of what the standard says about that. And if, then you're going to allow that voluntary use, they need that medical questionnaire. These are things that I would say weren't very common, that we may actually see happen much more often now.
And just remember, there's two choices with that. You can either say no as the employer, or if you say yes, that opens the door. But fit testing is not required when it's voluntary use. You get out of doing the fit testing because it's voluntary use. There's no hazard. That's why you're allowing them to wear it. But if there's a hazard, then you do have to provide it, and you do have to fit test.
Yeah. I think that's all good stuff. If we've covered the concerns and potential issues to the degree that we need to, I think the next natural pivot is to move to what are the new best practices for managing a respiratory protection program during this season. Undoubtedly, we've already kind of gotten to some of these as well with the rich discussion we're having, which is great. Dr. Kusti, if you could lead us off on this one, just so we can make sure we've covered this well. What are the new best practices for managing a respiratory protection program during this season? And if we could cover, things such as safety measures, health screening, and even look at covering some of the guidances that are out for qualitative and the controlled negative pressure testing instruments. And I know that Dr. Lynch has a lot of good information on that. So Dr. Kusti, with your main focus, best practices, especially factoring in safety measures and health screening.
Yeah, and I'll be quick because I know Dr. Lynch has a lot of good information, but I've touched on this a little bit before. A lot of employers, as part of best practices, are making all the workers who are coming into their facilities, whether for fit testing or even just regular work, go through a risk assessment, risk stratification assessment or survey, and those who are deemed to be high risk are going to get additional evaluation before they're allowed to the workplace. Also, I've mentioned that even before we start fit testing, a medical clearance needs to happen for the type of respirator. And I've also mentioned that the spirometry part of the fit test, though it is a common practice during the clearance, it is not a mandated requirement to clear somebody to wear a respirator. And therefore, the ACOM, the American College of Occupational and Environmental Medicine, has put out advice specifically for COVID-19 to suspend doing spirometry at this time. And we also touched a little bit on practices such as having the tester protect themselves by practicing universal precautions and utilizing proper PPEs, proper cleaning of the testing area and the testing equipment before and after each worker is being tested. Also making sure that as space allows, the people in the same room, the testing room, are practicing physical distancing and also practicing enhanced personal hygiene, such as hand washing with water and soap for 20 seconds or using hand sanitizers before and after touching the equipment and the testing supplies in the room.
Mr. Varner, any thoughts for us?
I think you did a good job. That's good. Let's just continue. I'm good.
Very good. Dr. Lynch, anything that you could share with us on that? And then I know that you kind of prepared to really talk about best practices with qualitative testing and controlled negative pressure testing.
So when I think about safety measures with fit testing now, we mentioned the maintaining your physical distancing, and I think that's important. And as Dr. Varner pointed out, with the Quantified, you have the benefit of being able to perform those tests outside and still have that space. And we know that outdoors we're limiting a little bit of the risk too, which is really good. But all sorts of things, like when you have your fit tester, you want to identify which PPE they should be using, disposable gloves. You're going to want to maybe do where they're having an actual lab coat that they're able to remove and disinfect, depending on how many people they're going to be exposed to and on your best guess at that. Then you're going to have them set up the room in a way and clearly communicate that you are maintaining that physical distancing, which means you're going to have to be a little bit better about your verbal cues. And this is all something that you, again, is going to go into your planning. So as you go through your fit test, you're going to be able to, with the Quantified, have the user walk through the steps on the machine, which is going to then involve them possibly contacting the machine. And then you also have to think about the fact that with that exhalation valve through the respirator, like we said, if we're assuming that everyone is a possible carrier, then you've got that contaminant coming out and getting onto all your surfaces. So right now, and maybe moving forward, we're recommending the use of possibly even 2 sets of tubing and adapters, so that then as one is used in a fit test, you're able to decontaminate those using an EPA-approved disinfectant that's been shown to be effective against COVID-19. And that can go as far as completely submerging them. You can also just wipe them down and then provide the tubes the time to, the adapters and tubes the time to completely dry. That is a really important point to note, that if you do that, then those tubes and the adapter have to be completely dry before you use them again, which is why it might be beneficial to have the 2 sets that you're able to rotate through. Then that also comes back to making sure you have the appropriate disinfectant available, whether it's wipes or you're doing a spray. You want to make sure you have all of those things available to, between each user, go ahead and wipe down all of those high touch areas, including the machine itself. Then also with the qualitative, same sort of idea. You might want to go ahead and have 2 sets that you're rotating through, so that as you use the hood or your nebulizer with one person, you're then able to clean them off and set them aside and allow that time for all of the air to clear out and for the hood to dry again, and your nebulizer to dry again before you use it on another person. So having those 2 sets, having the clearly defined areas where you're going to be decontaminating equipment and where your now clean equipment is. These are all things that should go into that planning. How you're going to have people certify that they've come in and been fit tested. You know, there might be a different way that you need to do this now, whereas you used to have a sign-in sheet. That might not be the greatest solution right now, because then you're going to have to get into disinfecting that area too. So you just want to make sure you're staying that 6 feet away and walking through the steps, which may need you to be a little bit more clear with your verbal instructions than you've had to be in the past, and that's something you're going to want to work through. So yeah, then you're going to want to discard any disposable PPE you were using, your gloves, for instance, and put on a new set between the different people. Always wash your hands. Is there anything that the panel thinks I'm overlooking?
I think you did a really nice job covering that. One thing I found with the employers that I'm working with, and it's very simple, very cheap, and you've probably seen it, is to put tape markings on the floor to identify distance, and the tester can know, like, I need to be behind this line while the test is in progress. The worker who's being tested would know exactly where they need to be and not wander around, and obviously not touch anything. The facial cover should stay on until the actual respirator being fit tested is going to be fit tested. So just because I'm, sitting and about to get fit tested doesn't mean that I should remove everything. I should keep the face cover until I act on the actual respirator that I'm being tested, fit tested for. That's when I remove my, if you want to call it the face cover that I came with.
That's a really good point, and I think I had overlooked the mentioning of still operating with the facial covering. When you have any of the people coming in, you're trying to just limit their germs getting out, right? So there's that particular moment where you're having to be fit tested where they're not going to be able to wear that facial covering, but outside of that, they should be wearing that facial covering just to limit the amount of contaminant that we're dealing with. Because again, it's the other people that are at risk. So that was perfect.
Love it. Anything else to add on that?
Yes, you got the people sharing respirators for fit testing. That's out the door unless you think you're going to take time to clean it before you give it to the next person, which would require disassembly. So that whole sharing thing is an issue with that involved. OSHA, we've used Confidence Plus for years for cleaning solutions. I've heard a lot of people trying to come up with, how can we clean it? Can we just spray it with this product that we got at this grocery store? All these ways to clean is making sure what product you're spraying on what is compatible, and making sure those
product is. I'm so sorry. I'm making sure that product is available, and then that just made me think that you also want to ensure that whatever space that you're utilizing has the appropriate and adequate ventilation for whatever disinfectant you are using. But that's a really good point. The use of surrogate respirators would not be, in my opinion, advisable, maybe moving forward, but definitely not right now.
Yeah. So between that, that type of a respirator being involved, and then of course they're supposed to be wearing the respirator 5 minutes before fit testing anyway, and actually 5 minutes prior to that for comfort fits. So you've got people staged wearing respirators prior to, before fit testing, and then you've got people maybe out from that wearing a face covering. So that's why I go back to the whole planning. Who's staged where are they at? That person's fit tested next. They've already got their respirator on, but they're also breathing the air. So just some words of caution.
And I would second Mr. Werner on, I have been giving specific advice against sharing respirators, just like Dr. Lynch said. For the time being, that practice is no longer recommended in my opinion.
Yep.
Now, I have heard for the qualitative, just to preserve some of our supply with those N95s, that you can use that for your fit test and then place it in your paper bag to then have a subsequent use of that mask for yourself. And so I do know that in the current atmosphere, I don't know how deep in a shortage we still are, but if that's something that applies to you, I have heard that that is acceptable.
And that's some of the recommendations from CDC from that when we talk about the strategies for respirators in a shortage. What can I do? What ways to still conserve? But you bet, because if they do something to that respirator and puncture it or do whatever, then it eliminates from normal use.
Mm-hmm.
Great stuff all around. I think we're hitting the mark, and this has been very beneficial for someone who would be looking to re-implement or manage their respiratory protection program in this season. I'm extremely appreciative of our panel for sharing a lot of the thoughts that they've covered today. Some of my major takeaways were it's absolutely a time to evaluate your respiratory protection program. There's a lot of guidance out there that you're going to want to consider, everything from the CDC to OSHA to ACOM. I love Dr. Lynch's brought up the AIHA, which is not specifically for fit testing, but has a lot of great information just for how to manage something in a well way in this season with safety in mind. The COVID questionnaire or survey that Dr. Kusti brought up, and really kind of finding a risk assessment before people would potentially even come in. Additional PPE for fit test operators, even to the point where they've got a respirator, I thought was a fantastic idea. Overall, extra resources for your respiratory protection program, cleaning supplies, PPE supplies, et cetera, et cetera. And I think the biggest thing that stuck out to me over and over and over again is just plan. And I think it's fair to say that everybody on the panel and myself knows you can only plan so well in today's environment, because it seems like tomorrow it's going to take a hard left turn. But you just plan to the best of your ability with having that PPE, having the floor markings, having your staged people. I think the more you can evaluate your program and the better plan you can put in place, and then bring a level of flexibility and being eager to be adaptable as the situation continues to change, is probably the best case scenario you have to still provide everything you can in good conscience for our workers. So I've really enjoyed getting a chance to sit in and just gather y'all's thoughts. I believe that this will be a great resource. If either of OHD's technologies could be beneficial for you as you're managing your respiratory protection program, whether it's the Quantified, doing that fast, easy, accurate, quantitative fit test, once again, doesn't require you to probe a respirator, doesn't require consumables, doesn't require a testing environment, which was brought up several times, which is a neat feature of this technology. There's no threshold of ambient particles required to run this device. So you can run it indoors, outdoors, large room, teeny room, doesn't matter. And it's very accurate because it's the only quantitative testing technology that challenges a respirator with air to determine its fit and integrity. So if the QuantiFit could be of service to you, or the new innovation, the QuantiCheck, if removing the subjectivity and the challenge of a user seal check or a fit check resonates with you, and you would like a simple, accurate, quantitative result brought to your fit checks or user seal checks, that innovation would potentially be very beneficial for you in this season. We believe these two technologies paired, by the way, provide a real unrivaled safety for your workers. And just to give you a little vision of what OHD feels these two devices can do when they're paired together, the QuantiFit's going to do a fantastic fit test, and it's going to check the fit and integrity of your test here, of your respirator here. You'll become due for another fit test in a year or two, depending upon your regulatory body, and that will be the opportunity for your QuantiFit to do another fantastic fit and integrity check of the respirator. The beautiful thing about the QuantiCheck is you would be able to quantitatively bump check that respirator on whatever basis you deem necessary in between these two fantastic fit tests. And at the end of a year, you literally could have the data in a picture of an individual's fit test, all of their quantitative fit checks or user seal checks, and then another fit test right here. So it just brings an unrivaled health and safety aspect to a respiratory protection program. So if either of these technologies could be beneficial, we are very eager to provide any additional support required, whether that's an on-site demonstration, or if you would like an interactive web demonstration, OHD's ready and prepared to provide either of those. So we've got that taken care of. I want to thank our panel members. Y'all are phenomenal, and I really appreciate y'all taking some time and sharing your expertise with our customers and visitors who are experiencing OHD for the first time. I really hope and believe they're going to get a lot of benefit out of this. So thank you to our panel members.
Thank you, Booth.
Yes, sir. Little bit action steps. Do you have any questions for OHD or any questions for our panel members? They've been kind enough to provide their contact information, and that's about to be provided as we wrap up this panel discussion. Please reach out to Dr. Kuste, Mr. Marner, or OHD, myself, Dr. Lynch, and we're excited about answering any additional questions that you may have coming out of this panel discussion. I want you to be aware that OHD is going to be producing some additional content in this season. In the next several weeks, I'll be providing a QuantiFit and QuantiCheck training. So if you know anybody who needs an introductory training to any of our technology, or if you know someone who just needs to brush up on their understanding and their training with our technology, that's going to be a great resource, and that's coming out in several weeks. Other than that, we really thank you for attending. We hope this will be a dynamic resource, and please stay safe. Y'all have a great day.